So my name's Chelsea, and I'm here to talk to you about my practicum and the practicum case. So just a brief overview. I'm going to briefly touch on confidentiality. Becon, which is the organization I was fortunate enough to do my practicum. The case, aspects of language, which was a big theme that emerged from my case, and just in general how the courses helped me in my practicum. So first of all, to ensure confidentiality, I won't be identifying any staff members, persons served, or agency-related matters. I'll just be talking about general policies, and also any photos in the presentation were taken with permission from the agency. So Becon is a multi-service organization which supports individuals with developmental disabilities. They have services such as group homes, and they contract out home shares. They serve over 100 individuals all across the island, as far north as Campbell River, and they also have services on Salt Spring Island. So my major assignment while I was at my practicum was to do a complete update and overhaul of their entire policy manual. So this involved a lot of researching policies from other organizations, which fortunately they have a lot of collaboration going. And they also helped when I had to create brand new policies, such as ones around social media, so I didn't have to pull everything out of my head. And I had to make sure that reflected current operations as well as external standards, such as workplace safe BC's bullying and harassment policy. And they're also changing their name to Be Connected, so I had to change the brand as well. The main issue was some of the policies were not presented clearly so everyone could understand them. So the solution to this was to place an emphasis on how they were written. So, 4 main categories of language: how disability policy was historically written, health literacy, the concept of words as barriers, and public participation. Historically, policy around disability has been treated with the medical model, where they see disability as a medical condition which needs to be fixed. Becon is more on the social or empowerment models of disability, which view disability as a socially created problem and works to empower individuals to attain their goals by overcoming the challenges present in society. Some of the policies were outdated though, and although the information was still relevant, they contain language such as client, which is very medical sounding, and they no longer like to use the word. So we had to change it so it said person served or resident. Health literacy, the ability to access, comprehend, evaluate, and communicate information as a way to promote, maintain, and improve health in a variety of settings across the life course. The language within the policies needs to reflect the health literacy level of the users, but since we don't know the health literacy level of all potential users, it had to be as plain language as possible. One way to overcome this challenge is to understand that something as simple as a word can become a huge barrier to understanding. You can misinterpret or just not know the words that are used in policies. All drafts of new or drastically revised policies which I made were presented to the Continuous Quality Improvement Committee. It's made up of a bunch of managers from the group homes and some of the directors. And it was helpful to hear feedback from people who were actually using the policies, what was missing or what could be misinterpreted. And it allowed me to create a final product which was really accessible to everybody. The only limitation of that was it was only managers that were giving me feedback, which is a very small public. Feedback from frontline workers or family members or even the residents themselves would give me a much better understanding, but due to time, resources, it wasn't possible. And just generally, in summary, Before entering the program, I had no idea about health literacy or anything. And if I had tried to do this policy update, I probably would have used big, complicated words, trying to sound as smart as possible, and it would have have a negative effect on the overall policies. So that is my presentation. Thank you for listening.
Questions for Chelsea? Did you hear the reaction from the crowd when you said that what you did was revise a policy manual?
I'm just interested to know how Becon reacted to you educating maybe them a little bit on the idea of language in policy. Did it affect them in any other ways to revise other things having to do with the services they provided, or?
They're pretty conscious already about language. They have like resident family handbooks, and they're all like colorful with pictures, and it's all plain language. So they were pretty aware of it. It's just the policies were older, and they just need to be updated.
Well, that's good to hear.
Any other questions?